Today we will be discussing the physiology of lactose intolerance. Lactose intolerance is the body's inability to digest the enzyme lactose, which is found in dairy products. Lactose is the milk sugar which forms when two sugars, glucose and galactose, come together. Lactose intolerance is also known as lactose malabsorption, and while harmless, is often quite uncomfortable. It is possible to have a low level of lactase and still be able to digest dairy, but if lactase levels are too low, lactose intolerance ensues. The lactase enzyme is located in the brush border or microvilli of the small intestine and enterocytes. Lactase works to split and hydrolyze lactose for transport across the cell membrane and turns the enzyme into the simple sugars of glucose and galactose. Two simple sugars typically enter the bloodstream through the intestinal lining. If lactase deficient, lactose from food moves into the colon rather than being processed and absorbed. In the colon, normal bacteria interact with undigested lactose, causing the signs and symptoms of lactose intolerance. Unabsorbed lactose not only increases the volume and fluidity of the gastrointestinal contents in the colon, but it is also affected by bacteria. The process of fermentation produces gas and leads to division of lactose into what's known as monosaccharides. These monosaccharides are unable to be absorbed by the colonic mucosa, which results in a further increase of osmotic pressure and the drawing in of more fluids into the bowel. In patients who are lactase deficient, some carbohydrates that reach the colon are able to be metabolized by bacteria and properly absorbed, but all in all, the ingestion of lactose leads to a substantial rise in fluid and gas in the bowel. There are three types of lactose intolerance. Primary lactose intolerance is the most common and entails life beginning with enough lactase, but as an individual ages, lactase production falls. Secondary lactose intolerance occurs when the small intestine decreases lactase production after an illness, injury, or surgery, which involves the small intestine. Related and connected diseases include intestinal infection, celiac disease, bacterial overgrowth, and Crohn's disease. Treatment of these underlying disorders can sometimes lead to the restoration of proper lactase levels. Congenital or developmental lactose intolerance is the third type of lactose intolerance. While it's rare to be born with lactose intolerance due to a lack of lactase, the disorder can be passed down from generation to generation through a pattern of inheritance known as autosomal recessive. For this to occur, both the mother and father must pass the same gene variant to the offspring for the child to be affected. However, it is possible for premature infants to have a lactose intolerance disorder due to underdevelopment and an insufficient lactase level. Radiation therapy for cancer of the stomach or intestinal complications from chemotherapy can also increase the risk of developing lactose intolerance. Common symptoms of lactose intolerance include abdominal pain and bloating, excessive flatulence, and watery stool. However, most common is general uncomfortability. Symptoms of lactose intolerance are directly related to the osmotic pressure of the substrate in the colon and typically occur around 2 hours after consumption of lactose. Diagnosis of lactose intolerance can be made by determining personal medical history and also manipulating the diet. If necessary, a breath hydrogen or lactose tolerance test can be ordered. A hydrogen test entails the ingestion of a set amount of lactose and a measurement of the hydrogen concentration of the breath following the ingestion. The test is based on the idea that carbohydrates in the colon can be detected within the excreted hydrogen and other gases. If a rise in hydrogen concentration greater than 20 parts per million is detected, hypolactasia is labeled as the assumed cause. The lactose tolerance test entails the administration of an oral dose of lactose calculated by body mass, and then the collection of serial blood samples to be tested for blood glucose levels. A result is considered positive if the occurrence of intestinal symptoms is present and if blood glucose levels are found to increase by less than 20 milligrams per deciliter. Lactose tolerance tests are commonly found to lead to false positive and false negative results and are therefore not as reliable. The breath hydrogen test is the more commonly used of the two tests and has been found to be more accurate than the lactose tolerance test. As for the commonality of lactose intolerance, approximately 68% of the world's population experiences some level of lactose malabsorption. Lactose intolerance is more common in African Americans, American Indians, Asian Americans, and Hispanics and Latinos. As many people from European descent naturally contain a gene that assists with the proper breakdown of lactose, those of European descent are least likely to experience lactose malabsorption. Due to the wide variation of prevalence, it is believed that lactose malabsorption is the natural state of land mammals, whereas the retention of lactase activity into adulthood is an abnormal mutation. It is being studied to determine whether or not the continued consumption of lactose post-weaning is the cause of lactase activity retention.